So let's say you were on the labor and delivery floors, or were on call the previous night as the med student, and you're in charge of seeing your postpartum patient the next day. This video is going to help you figure out what you should do when you walked into the room. As you've probably already realized, you're walking into the room somewhere between 5 and 7 a.m., and while most of the women are excited about their newborn, they are probably slightly less thrilled to see you at the crack of dawn. Therefore, come in prepared and be efficient. We'll go through this postpartum check in the style in which you'll be writing your note. So, start by asking your typical open-ended questions about how the patient's night went or how the patient has been since you've last seen them. Some of the big points to pick up on include whether the patients are in pain, and if so, whether the pain has been adequately controlled. This is especially important for the C-sections. Next, ask the patient about breastfeeding. Are they having difficulties with breastfeeding? Do they have any complaints of redness or tenderness, which might suggest a mastitis? And do they plan on breastfeeding or using formula after leaving the hospital? Finally, ask about plans for contraception. While continuous breastfeeding will work as a contraceptive for approximately 6 months, if a patient chooses to use a combination of breast and bottle feeds or bottle feeds, their menstrual cycle may begin between 6 and 10 weeks after delivery. And finally, if this was a C-section, ask the patient whether they've passed gas or had a bowel movement, and if so, have they been able to eat? Passing gas, of course, signifies that the bowel is active and the patients can start eating. Check to see if the patient has had problems with nausea and vomiting post-op as a result. For objective, include a statement about general appearance in your note. Easily 99% of the patients will be awake and alert and no acute distress. If they are in distress, hopefully you've already figured this out from your conversation or someone has clued you in. Take a listen to the heart and lungs. Typically, these are going to be regular rate and rhythm, no murmurs, and clear to auscultation bilaterally. Next, do an abdominal exam and listen for bowel sounds. Again, most of the time, this should be soft, non-tender, minimally distended with positive bowel sounds. The abdominal exam is most important for the C-sections to make sure the bowel has woken up and there are no other surgical complications. Next, push hard on the belly and feel for the top of the fundus. It usually takes a few postpartum checks to really understand this on your own. I suggest going in with a resident or nurse and asking them to show you. The top of the uterus should feel hard and clamped down. Clearly, the further out from delivery, the further down you should feel the top of the fundus from the umbilicus. You want to estimate how far from the umbilicus the top of the fundus is and write this down in your note. Now next, take a look at the patient's perineum and look at the laceration repair. Is it intact? Is it bleeding? Or is it separating? If this was a C-section, take a look at the incision. Hopefully you can report that it's clean, dry, and intact. Now take a look at the pad and determine whether the patient continues to have lochia or vaginal bleeding from the delivery. Note whether it's scant, minimal, or heavy. Ask your resident or attending as to whether they'd actually like you to examine the perineum every morning, or whether you would need a chaperone, especially if you are a guy. In some cases, you might be told to try to gather this information verbally, as the residents will always do a double check of this. Finally, make sure to check the extremities and determine if the patient has edema or leg pain, which might suggest a DVT. Now, when writing the note, the typical assessment and plan will go something like this. 30-year-old G1 P1001, postpartum day number 1, status post, normal spontaneous vaginal delivery at 40 weeks with uncomplicated labor and delivery. If there were other events, i.e. poor pain control, put this in the assessment. In the assessment, you may also want to add a few words about pain control, nausea, vomiting, ability to tolerate diet, and whether the patient is passing flatus, if you hadn't already covered it in more detail in the subjective portion. For the plan, you might want to include something about breastfeeding, contraceptive options, and expected discharge date, as well as any changes to diet or ambulation as you see fit. Now, as far as take-home points go, one note, These visits can really be done within 10 to 15 minutes once you get the hang of them. However, you really should spend as much time as you deem appropriate. My suggestion is to write out a template similar to the one below, photocopy it, and bring it into each of your postpartum checks. This will help tremendously at the beginning when you're getting the hang of things and when you're writing the note. Be prepared, however, to add and revise your template as you go on to reflect everything that you should be covering. This guide should have the majority. So good luck!